Hi, everyone. Hi, everyone. I'm Helen French, Director of Development and Continuing Education at NASW, New Jersey. Thank you so much for joining us today. I am thrilled to be on with Sandy Gibson, who's a professor at the College of New Jersey, and Jen Oliva, who's Associate Dean at Seton Hall. They're going to be joining us at our NASW New Jersey 2022 conference, May 1st and 2nd. You can register at thefutureofsocialwork.org. They're going to be talking about anti-racist addiction treatment requires decriminalization and harm reduction. They're both terrific presenters and subject experts. So thank you so much for being here.
Thank you for having us.
Maybe you can start off, why is this important? Why is this an important topic?
This is an important topic because there is enormous social injustices and racial disparities associated with how we approach our drug policy in this country. And it's not by accident, it's actually by design. It was specifically designed to target Black and Brown communities and disempower them and really tear families and communities apart. And it has been very effective in doing exactly that. And we continue to implement our drug policy in very racist ways still today. We grossly over-police and over-incarcerate Black and Brown communities. If you're Black or Brown in the state of New Jersey, you're 3 times to 14 times more likely to be arrested for a drug charge, depending on which county you live in, which was, a big part of the whole legalization of cannabis push. And so many sort of stop and frisk, we don't call it stop and frisk here, but if we pretended we smelled marijuana on you, we could all of a sudden search you, search your car. So with the legalization of cannabis, that's no longer an option. We can't just randomly claim to smell something and then all of a sudden start searching you and your property. So we're taking these gradual steps towards trying to create some degree of equity. And then by reworking the drug policy, decriminalizing drugs in the state, we can take the money that we currently spend on the criminal justice system and put it into the public health and the social service system. And most countries around the world do not have a criminal justice approach to their drug policy. They have a public health approach, and that's what's encouraged by the World Health Organization, the Global Health Initiative. But we keep companies with the Philippines and Iraq and like Saudi Arabia. Those are our policy partners for drug policy. So if you think about who our partners are with how we approach people who use drugs in this country, it's really a very unfortunate situation, and we're working to change that. We think about, talk about or think about any person who uses drugs that you care about, and then ask yourself if that person belongs in a cage. And by this drug policy of incarcerating people, it completely ignores all of the social determinant consequences of our drug policy, of tearing families apart, taking fathers and incarcerating them for a lifetime because they had individual amounts of drugs on them with possession, but the mandatory sentencing laws that we've had. We need to not only stop the racist drug policy, but we need to start repairing the harms this policy has done to our communities throughout the state of New Jersey. And we're not alone. So Oregon did this a year ago, and I think there's 7 or 8 different states right now with active legislation pending for full decriminalization. So we think this is something that's absolutely going to happen. And when it happens, not even when it happens, even now, we need as social workers to start integrating harm reduction work into the services that we provide, because that's meeting the client where they're at. If someone's using drugs, we need to meet them where they are instead of forcing a goal of abstinence on them, which may not at all be their goal. 90% of people who use drugs do it recreationally and non-problematically. So we have to stop imposing our values on other people, meet them where they are, keep them safe. Countries that have decriminalized, enormous reductions in overdose deaths, enormous reductions. So we have an overdose crisis here. And this is a big step that will take a huge piece out of that problem for us. So there's just so many reasons to be doing this and really none not to.
I couldn't agree with you more. And I just want to add a few things about law enforcement resources and law enforcement policy. Everyone has heard the phrase, we don't stick to it in drug policy, but everybody's heard the phrase, the definition of insanity is doing the same thing over and over and getting the same dastardly result. And we've been doing this stuff from 1970 till present, over 50 years since we enacted the Controlled Substance Act. And we have the highest overdose rate we've had during that time period last year. So it's just not working, folks. It's not working. The other thing I want to say about policing, and Dr. Gibson alluded to this, is not only are we devoting a tremendously high percentage of our law enforcement resources to low-level drug offenses, police have very poor statistics when it comes to index crimes. And what I mean by index crimes is crimes that you think about. These are the law and order, the bad crimes you think about, like murder, burglary, assaults. We're talking about brutal, violent crimes where people are truly injured. Police have very low clearance rates. Those are tougher crimes to solve. They require dedicated resources and trained policing. And when you're dedicating 80% of your stuff to street marijuana, it's much more difficult to actually resolve those very, very serious, significant crimes that have huge impacts on the community and people's lives. So that's just something else that I wanted to point out. My last little anecdote to try to get you interested to come to listen to our talk is that I was one time arguing with a Supreme Court justice in Ohio, and I was arguing for better access to treatment and non-coerced access to treatment for people with substance use disorder, which Dr. Gibson will talk about eloquently during our presentation. And she said to me, why do you keep comparing these folks to diabetics? Because I had said, well, we wouldn't take insulin away from someone who suffered from diabetes. She said, diabetics don't commit crimes to get insulin. They don't harm other people. They don't steal money. And I said, take their insulin away and see what happens with diabetics, right? We think it was cruel and unusual, a huge violation of basic human rights or norms to take medication away from someone who suffered from virtually any other condition. And Dr. Gibson will talk to you about course treatment and how we've stuck to our guns on that again for 5-6 decades now, and it's been an abysmal failure. So thank you for having me today. I'll turn it back over to Helen.
I've had the pleasure of working with both of you a couple of times, and this was a new subject for me, and I'm sure it's new for many other people. How's the community responding to this work?
It depends on the community. So I do a lot of education of social workers, and social workers have been phenomenal. So they're all on board. They're big advocates. They recognize the social justice issue that it is. Some people are having a slightly harder time recognizing the harms caused by compulsory treatment, especially because a lot of us have been a part of that system. And so it requires us to take a look in the mirror and say, whoa, I've been a part of this to some degree, and I really need to start looking at how my agency operates or how my practice operates and rethink whether or not I want to be a part of this problem. And so that takes a little more soul searching. But people are willing, that's the great thing about social workers. We are happy to call ourselves out. We are happy to do that soul searching, and we're happy to do like course correction. So, I've been presenting to licadas across the state, and some licadas have prosecutors in them, and those prosecutors get a little defensive, right? Because everyone wants to believe that their actions are benevolent and they're doing good things. And our drug courts are good things. Like, people want to believe this, right? Because we don't want to think we're hurting people or creating harm. We want to think that we're making society better. And so that transition of, oh, what I'm doing is actually harmful and I'm making it worse, not better, and I need to change. It takes some really deep inner strength to embrace that and then to act on it. And so there's been some challenges, especially when we get more involved with the criminal justice system related folks who, are like, wait a minute, that's my job, kind of thing. So it's been a mixed bag, but we have legislators who are supportive. We have there's a lot of support. I would say when I do presentations, I get 90 to 95% support, and a lot of discomfort and realization, and wanting, especially with social workers, how do we get involved? Like this awareness and wanting to almost make amends by getting involved and making this happen, which is why I love social workers so much.
Excellent. Yes, Jen, You
Oh,
was-
I absolutely agree. I do think we've seen some movement. I mean, I'm very proud and was somewhat surprised by the unanimous support that cannabis decriminalization got from the New Jersey Bar Association. So thank you, lawyers. It's always a contentious issue, as Dr. Gibson mentioned, when people, make their living and have dedicated their life to these things. A lot of folks truly, truly believe, look, a little coercion goes a long way. We're going to help these people and get them into treatment. So why not just arrest them and give them the services they deserve? Fact of the matter is, the long arm of the law then wraps around you like an anaconda and squeezes so hard and takes so many things away from you. You no longer can maintain, or you're suspended from your professional license or ineligible to apply for it, right? You lose all sorts of other rights, and it just sort of squeezes you. And we think we're helping folks when we're doing that, but the law has picked on this and stigmatized this particular condition for so long. There's more than 1,500 collateral consequences that are visited on you from that arrest. And then on the cherry on top is that the coerced treatment doesn't work, as Dr. Gibson already said.
So you're great presenters. You're going to present a lot of information. What kind of actions can social workers take to help with this situation?
So we need to start talking to our legislators. They want to hear from you. And NASW New Jersey has been fantastic and involved in doing their own advocacy work, which we are so grateful for. But reaching out to your legislators, we also have a website, which we'll share with you, Abolish the Drug War New Jersey, where there's going to be a sign-up form where you can sign up and give your information so that we can collect that from you and reach out to you when there are calls for you to be reaching out to legislators, writing emails and sharing your position. Starts educating your agencies and your practices where you are, because you may come out of this and feel really inspired to become engaged, and then return to an agency that doesn't understand what you're trying to do and why you're trying to do it. So sharing that education, a diffusion of this knowledge across the state of New Jersey is so important. And we will come to your agency, right? Like I will, tell me if you want me to come to your agency where you work, I will come there. I will talk to people. So there's like, we are spending a year just going around doing community education. So we are available to come to your county. If we haven't hit your Licata yet, give me a call. We'll come to your Licata. We want to be engaged. We want to educate. We want to have this conversation.
I'm just going to add on top of that I can't count the number of times that I've asked a social worker for a favor, either to write an expert report, to show up to court to testify on somebody's behalf, to speak to someone who's got a VOP or some other kind of violation. You folks are really important in the criminal justice system. You can make a huge difference and have a huge impact. You're the expert. You're there to inform the judge and the jury about what's going on with this stuff. So the amount of impact that this particular profession can have in this arena is boundless. So just wanted to mention that as well. You all are can be huge advocates for doing the right thing in the criminal justice system.
Sandy and Jen, thank you so much for joining us on this Facebook Live, and thank you for your dedicated work on behalf of vulnerable populations. Everyone out there, you have to join us. Very entertaining and informative from Sandy and Jen. You can register for the conference at thefutureofsocialwork.org. The conference will be held May 1st and 2nd. And thank you so much, Sandy and Jen. We do appreciate you.
And us you.